Hi everyone, good afternoon. I am Nexanza Daisy, a student at Macquarie University, currently pursuing a bachelor's degree in software engineering. I'm going to take you through an artificial intelligence project, firstly, what is artificial intelligence? Artificial intelligence, these are machines or systems that use human intelligence to perform tasks. My project is automatic diagnosis of respiratory disorders, and this project basically bases on audio or visual information, which is mainly represented to the medical specialists as images or sounds. Mhm. The use of automatic and reliable tools can help to diagnose more people and help specialists to make less mistakes due to work overload. As you know, doctors can receive so many patients, and if they are using the traditional way, of course they cannot handle all of the patients in time. So we use these automatic tools to diagnose more people. It also gives patients customizable tools for medical monitoring. Mm. How do we apply artificial intelligence solving the problem? We use artificial intelligence such as machine learning models, which are used as inputs for inputs of data, subsequent classifiers for detecting unhealthy sounds. We can also use deep learning models in which audio waves or corresponding spectrogram are directly fed into the deep neural networks, which output the predictions. Mm. The data type used about the data sets. Here, I consider the respiratory sound database as the dataset, which requires the use of audio recordings to detect respiratory diseases. I'm going to describe my dataset. The sound emitted when a person breathes is directly related to the air movement, changes within the lung tissues, and the position of secretions within the lung. A whistling sound is a common sign that a person has an obstructive airway disease like asthma or chronic obstructive pulmonary disease. These sounds can be recorded using digital stethoscopes and other recording techniques. This digital data this digital data opens up the possibility of using machine learning to automatically diagnose respiratory disorders. What are the differences between supervised and unsupervised learning? In supervised learning, machine learning relies on labeled input and output training data to train algorithms in predicting outcomes accurately. In unsupervised learning, unsupervised learning uses machine learning algorithms to analyze and gather unlabeled data sets to find hidden patterns in data without human intervention. Supervised machine learning is generally used to classify data or make predictions. Unsupervised learning is generally used to understand relationships within data sets. Also, supervised learning is much more resource intensive because of the need for labeled data. Unlike supervised learning, in supervised machine learning, it can be more difficult to reach adequate levels of explainability because of a less human oversight. Supervised learning techniques. There are two supervised learning techniques, that is to say, classification and regression. In classification, based on my project, where we're going to use audio recordings from the recordings data from the patients. Classification can be used to separate the clean respiratory sound from noise recordings, which with crackles and whistles, which stimulate real-life conditions. Regression on the other hand can be used to establish a mathematical equation that identifies and characterizes the interactions and patterns between different variables, finds best features, and focuses weight increase on misclassified data so that the importance increases and therefore entire system accuracy. Unsupervised learning techniques. There are so many unsupervised learning techniques, but there are only three main techniques, which include clustering, association, and dimensional unsupervised learning. Clustering. In clustering, we just find the commonalities between the data objects and categorize them by their presence or absence. In association, we use different data objects working in association, different data objects working hand in hand during analysis to find relationships among data objects. Those are the only ones I can explain to you today. More will be explained in my more videos. What are some of the artificial intelligence technical challenges faced by the project? One of the main challenges is artificial intelligence integration, which requires large volumes of well-structured data, and the algorithms must follow with variable levels of data quality, which is inaccessible. Also, there is abrupt power cutoff, which leads to the entire process to a standstill. And as a result, patients' lives may be at risk as X-rays penetrate through the sensitive body parts. There are so many challenges such as cyber security. There are so many more challenges such as cyber securities are, that is to say, spamming, hacking, and so many others to mention that but a few. I'll explain more in my videos. Possible solutions to the challenges. The use of standby generators to solve the problem of abrupt power cutoff. This enables diagnosis process to continue smoothly. Also creation of respiratory sound database to provide well-structured data through taking audio recordings from the patients for confirmatory testing. Differences between accuracy, recall, precision, and FI score. Accuracy Accuracy is one metric for evaluating classification models. Informally, accuracy is the fraction of predictions our models got right. On the other hand, precision is the fraction of relevant instances among the retrieved instances. Recall is the fraction of the relevant instances that were retrieved. Both precision and recall are therefore based on relevancy. FI score, this is a combination of both recall and precision. As explained in the above, artificial intelligence evaluation matrices for the project. As explained from the previous slide, the most appropriate AI evaluation matrices for the project. For the above project, the most appropriate AI evaluation matrices for the above project are as mentioned and explained below. Classification accuracy. Classification accuracy is what we usually mean when we use that term accuracy. It is the ratio of number of correct predictions to the total number of input samples. Confusion. We also have confusion matrix. In confusion matrix, as the name suggests, gives us matrix. Continue. Let's continue. Confusion matrix, as the name suggests, gives us a matrix output and describes the computer performance of the model. We also have logarithmic laws. It's also explained in the slides. If you want to learn more about my project, references are also provided in the slides. Have also some definitions and acronyms used. That is AI, for artificial intelligence, and COPD, which stands for chronic obstructive pulmonary disease. That's what I have for today. Thank you for listening. Subscribe to my YouTube channel for more videos.